As each year goes by, we're discovering more and more about the benefits of exercise. It is just fantastic for our health. And the tantalizing evidence that's come out more recently is that exercise may make the nerves inside our brains grow better and join together, and could be a way of preventing dementia. And it's that evidence that's recently been examined by Professor Ron Peterson, a world authority in the area at the Mayo Clinic in Rochester, Minnesota.
Many studies are beginning to show that aerobic exercise may in fact be one of the true lifestyle modifications we can use to prevent maybe the onset of some neurodegenerative diseases, Alzheimer's disease, Parkinson's disease, and maybe cognitive impairment itself. We went and looked at the entire literature to see what was out there and how strong the evidence might be. And I think the data are starting to lean in the direction that aerobic exercise may in fact forestall some of these cognitive changes of aging.
To what extent?
Well, there is increasing evidence that in fact if one exercises perhaps 150 minutes a week, meaning 50 minutes 3 times a week, 30 minutes 5 times a week, and by just brisk walking, that you can in fact reduce the risk of your declining cognitively over 12 months and perhaps 18 months. A study done in Australia, published in the Journal of the American Medical Association a couple years ago, demonstrated this in a randomized clinical trial format, meaning that subjects who had a memory complaint were assigned either to aerobic exercise or to usual activities, stretching, things of that nature. And those subjects who were randomized to the exercise regimen, in fact, had preserved or slightly improved cognitive performance at 6, 12, and 18 months later.
People who exercise may already have better thinking and memory function, which is why they exercise,
Right.
Or they've got better lifestyle, which may explain the benefits rather than the exercise itself.
You're quite right. Individuals who are more prone to exercise might have other lifestyle habits that are generally beneficial, diet, intellectual activities, and the like. But it looks like it might in fact be the exercise that is the key factor.
If it is exercise helping your thinking and memory abilities, why would it be doing that?
Well, there's several hypotheses about that. Of course, the most straightforward, which may or may not be contributory, is that you're just increasing blood flow to the brain, you're developing heart-healthy habits, you're actually improving your overall aerobic exercise tolerance. But there could be other biological mechanisms. That is, exercise may in fact induce some enzymes that actually clear amyloid from the brain.
Amyloid is one of the substances that accumulates in the brains of people with Alzheimer's disease. And research in mice is suggesting that exercise could help.
When these mice are randomized to a lot of running in the wheel, a little bit of running in the wheel, and not running in the wheel at all, followed them throughout their life, when they died, looked at the amount of amyloid in the brain, lo and behold, those mice who were randomized to the heavy exercise regimen, a lot of time on the wheel, had the least amount of amyloid in the brain than those who had the moderate exercise schedule or the no exercise schedule.
Given that the scientific panel a year or so ago found that there were very few proven techniques for preventing the onset of dementia or slowing the rate of thinking and memory decline, there are thousands of people around the world doing Sudoku puzzles and all sorts of intellectual stimulation, like learning new musical instruments, in the hope that it's going to help. Will it help?
I think this is a worthwhile activity. I mean, I think taking the evidence from a lot of these observational studies, which again we did in the meta-analysis, it really leans toward the conclusion that these activities are beneficial.
You've also been doing work on the diagnosis of dementia at an early stage. Tell me about your work in this area.
Well, we've been doing the Mayo Clinic study of aging here for about 8 years now, and this is a random sample of individuals who live in Olmsted County, Minnesota, age 70 to 89, who are not demented. So either they're normal cognitively, or they may have a little bit of a memory problem, what we call mild cognitive impairment. We see them every year, we follow them longitudinally. But we're also doing sort of cutting-edge, state-of-the-art technology measurements of them, meaning we're doing biomarker assessment involving imaging, MRI scanning, we're doing fluorodeoxyglucose PET scanning, we're doing PET scanning for this amyloid protein, and we're also getting spinal taps on some of these individuals. We also have blood and we have genetic backgrounds on these individuals. We're following them longitudinally, and we're trying to see which of these biological markers in fact will predict who's going to become cognitively impaired in the future.
And what have you been finding?
We're finding that the newly published criteria for the Alzheimer's disease spectrum, meaning the dementia phase, the mild cognitive impairments phase, and then even the preclinical phase, which means people are clinically normal at that point in time. But when we look at their biomarker profile, that in fact those individuals who do have, say, a positive amyloid imaging scan, or they have some atrophy, shrinkage on their MRI scan, or they have a suspicious pattern on their PET scan with glucose utilization, that those individuals do in fact progress on to mild cognitive impairment and ultimately dementia at a higher rate than the individuals who have negative biomarkers. Well, it's hard to know exactly which drug, which compound, which therapeutic event might be most successful at this point in time. But the reason that the trials have failed thus far, at least maybe part of the reason, might be that we're attacking the disease too late.
But some people are saying you've made the wrong assumptions, that you can find, once you start scanning people, you'll find people whose brains are absolutely full of amyloid and they're talking to you normally, they don't have any problems, and people just starting to say, well, look, the things you've been looking at are the wrong target, they're just passengers in this process, and all these drugs to remove amyloid aren't going to make any difference at all.
Well, it's a reasonable question to ask. I mean, amyloid may not be the end-all, be-all of the disease. Ultimately, we may need a cocktail of therapies to treat Alzheimer's disease. So it may take an amyloid active agent, it may require a tau active agent, the other abnormality in the brain, perhaps a vascular component. Many people as they age develop vascular disease. That may be contributing to the clinical picture as well. This type of an approach is not unique. That is, when we deal with high blood pressure, hypertension these days, we may use a variety of drugs with different mechanisms to treat that ultimate number, that elevated blood pressure numbers. Once we learn about the multiple targets out there, the multiple therapeutic targets, and then ways of imaging them, using biomarkers to detect their activity, and then tailoring the drug regimen for the specific markers. And then ways of imaging them, using biomarkers to detect their activity, and then tailoring the drug regimen for the specific markers.